Hi everyone, good evening from wherever you're watching from. Today, yet again, I'm talking about malaria diagnosis. Malaria diagnosis actually has different procedures or different ways. And I will list it briefly and I will explain to you how and what it detects and how it works. So, one of the malaria diagnostic method is MRDT, that is malaria rapid diagnostic test, which detect malaria antigen called Histidine is protein 2. So when it is positive, it means someone has malaria. But the only difference is that one will not actually quantify the amount of parasite. Actually, it does not quantify the rate of infection or whether it is severe or not, or whether it is +2, +1, or +3. It cannot detect that one. So that is it. It only detects the presence of what? Malaria antigen, not other things. And it also has some limitation. One of the limitation is, in most cases, this malaria rapid diagnostic test only tests for falciparum species, Plasmodium falciparum, whereby leaving others behind. Though Plasmodium falciparum is the commonest species of malaria which affects humans, others are also still there, contributing to around 15% of malaria infection. So, limitation of this malaria MRDT is that it only tests one species of malaria, though others are designed to test maybe one or two or three, but majority of these RDT test strip test for only one species or two. So the second method of diagnosing malaria is take blood smear. Take blood smear help detect malaria and quantify. That is when you will hear now someone is having malaria +1, +2, +3, but RDT cannot do that. So it what? It quantify malaria and it detect the presence of malaria what? Parasite. Then one of the advantages is it detect all the species of malaria and all its form. So there is no need of again saying that I need another test because this one has turned negative. So it rule out whether malaria is there or not, or it is always used after treatment to check the prognosis, how the response of a drug to that person. So that is when you do actually take blood smear. Then another one is called 10 blood smear. We talk of take blood smear and it has one limitation. It does not really clarify the species of malaria which has affected someone. So let's do the one of 10 blood smear. This one, it detects the presence of malaria